Well, hello everybody. We're back again. Today we are going to be focusing on the mouthing reflexes, rooting, sucking, and swallowing. Just as a recap, in the last few weeks, we started by talking about the withdrawal reflex, or not the withdrawal reflex, but the withdrawal movement pattern, if that is not even exactly the fear paralysis reflex isn't considered a movement pattern, but I kind of listed it first because it comes before all the other movement patterns, but it is a way that the fetus does kind of move or withdraw in itself, or the cells. Then we move into the breathing pattern, which was the Moro. And today we're going to be talking about the mouthing patterns, and the reflexes associated with the mouthing pattern are the rooting, sucking, and swallowing. This is going to be really short and sweet. The FPR, the fear paralysis, and the Moro are kind of heavy reflexes, but today it's just going to be short and sweet. So mouthing. Through the mouth is the baby's first way in being able to reach, grasp, and hold on to and let go. Because when it's a baby, that's the way that it latches on to the breast to eat. And then it also can let go. So it's kind of its first way of being able to do that. Rooting, sucking, and swallowing are the reflexes associated with mouthing. And so here's just to show you, very simply what the rooting looks like. Okay, so when the baby's cheek is stroked, it will turn to the stimulus so it can find the food and suck. So the rooting reflex is the baby's way to search for food. When their cheek is stroked on the video, the infant will turn its head in the direction of that stimulus, looking for the food source. In utero, when the mouth is stimulated and the baby actually turns away the stimulus, but as it nears birth, then it starts to turn toward the stimulus, so the rooting reflex is developing in the womb. After birth, the rooting leads to sucking. Strength of the, we actually see sucking in the womb as well, because a lot of you may have even seen your own ultrasounds where your baby was sucking its thumb. A lot of us have ultrasounds where the baby was sucking its thumb. The strength of the reflex depends on the time from the last feeding. So they find that if the baby has eaten recently and is full, then the reflex doesn't elicit much response, but if the baby is very voraciously hungry, then it does. It's strongest, as we said, the first couple hours after birth. And if the baby, it's strongest for the first couple hours after birth, and it doesn't receive gratification from its rooting, then the reflex will weaken, and then causing it to actually remain active. So the rooting reflex develops into a conditional reflex, where at just the sight of the bottle or the breast, the baby turns the head into the correct position in space. Rooting may help develop the facial muscles involved in smiling. The facial muscles are connected to the nucleus ambiguus in the brainstem. And, we've talked about that these reflexes live in the brainstem. So as we help, and this reflex would be on the facial nerve. So as we start to develop and integrate these reflexes, we're developing connections with these nerves are strengthening, the area in the brainstem is strengthening, and so then it is also connected to, in this case, the facial muscles. Sucking and swallowing are two additional reflexes. The practice of these activities help to coordinate muscular systems, to enhance central nervous system integration, to innervate the gastrointestinal functions necessary for digestion, leads into integration with other sensory systems, such as vision and hearing. It's activated by the stimulation of the hard palate, where it borders the soft palate, and it originates from the temporomandibular joint. And sucking, which leads to chewing, is very centering and stimulates the vagus nerve. And we already kind of mentioned that there was that relationship there. A developed mouth pattern diminishes tensions in the mouth and throat, resulting in a relaxed neck and face, and reduces the likelihood of speech difficulties. It increases coordination and encourages expression. Sucking is said to be the first form of dialogue between the infant and the mother. So as the baby is sucking, the mother is more passive, is kind of there. And then when it stops, then the mother might have to interact in a way maybe to try to get the baby to suck more. The baby stops and the mother is taking her turn, and then vice versa. In the brain, the first region of the neocortex to develop in the fetus is the part that will become the representation of the mouth and the tongue in the somatosensory motor cortex. So here are the lips and the tongue right on the sides. So this is the first part that's is going to be really developing in this area of the brain in regard to movement. So what happens if it's not integrated? If the rooting reflex is not integrated, the baby's going to have continued sensitivity and immature responses to the touch in the mouth region, particularly on the lips. So the infant may experience difficulty when solid foods are introduced because of a persistent suck reflex will prevent the tongue from developing the mature combination of movements necessary for swallowing, which can lead to drooling and even fine motor skills, like immature sucking and swallowing movement continue to affect the hands, causing involuntary palming of the hands. Talk about that later, but the hands and the mouth are connected, and one way that midwives sometimes get the babies to start to suck is just to press on the palms, and then the sucking can begin. Leads to poor speech articulation issues and possible needs for orthodontic treatment later on. They always say that babies who nurse for a long period of time tend not to need orthodontic treatment. And I'll say too, when I tested my son who has autism, he's 18, but when I tested him about 2012, so how many years ago was that? Like 7 years ago. So when I first started learning about reading, about 7 years ago or so, when we had him tested, he had a severe rooting reflex. So you would just brush the cheek. So this is how you test. You stroke the face from the corner of the mouth up. You can use a paintbrush or whatever, just from the mouth and up the cheek. And if in a severe case, you're going to literally see, even if it's an older child, them turning their head and kind of like wanting to, like, looking for that food, like as if they were a baby. In the older, in kids who are not so severe, what you might see is some twitching around the mouth, and even an adult might just say, yeah, I felt some sensation in my lips. So maybe it's not moving, but there's still some sensation there. So just notice any movement in the lips, the mouth, or the rotation of the head toward the stimulus. And that's the same way you're going to integrate the reflex, is you're going to be brushing the, take a paintbrush or something and just be stroking and just kind of desensitizing that area. So just doing that every day, a few times a day, should go away pretty quickly. Next week, we're going to be looking at the spinal movement, and we're going to be on the spinal one for maybe a couple weeks as we look at one reflex at a time for that one. And until then, putting children first, please check out our online store, Wishing Willow, mywishingwillow.com. We have a lot of products that are in our healthy living section. We have LED lights, a lot of EMF protection. We have a whole sensory motor category. So if you need like resistance bands or heavy balls or anything like to help that sensory motor development. And we are showcasing some of Joshua's art on different products. So we would really appreciate you joining us over there as well. And that's mywishingwillow.com. Thank you. Until next week, we'll see you then.